how do I know whether or not to move up in my dose? How does moving up in the dose mean more weight loss? Great question. Here's how we do it. And in fact, we're making a little algorithm that is going to help even further figure it out for us. Here's the gist. If you're losing up to, I'd say like 1.5% of your weight per week, like an easy 200 pounds. If you're losing like up to 3 pounds per week, you're okay to move up. If you're starting to lose more than like 1.5% per week on average, you probably want to stay. The reason is the studies didn't actually do this with their dosing. They just cranked people up. They didn't really care. Just keep going up. But when you're an actual clinician and working with people, you should probably consider other things like, hey, we probably don't want this person to lose much muscle and risk their bone health at the sake of just losing weight on the scale, because we do care about the quality of the weight loss. We want to keep our muscle, we keep our bone. We only want to lose adipose tissue, which is fat. Also, if you lose weight too quickly, you are at risk for increasing formation of gallstones, which can then increase the risk of a gallbladder attack and also pancreatitis. The drugs aren't thought to cause pancreatitis, although some may debate that. It's extremely rare. But if you get a gallstone, it gets into the wrong duct, inflammation, and whatever. So too fast. But the other thing is, if you're like kind of on that lower end of weight loss, let's say you're around 0.5% weight loss. So if you're 200 pounds, you're losing 1 pound a week, you'd say, oh, we should definitely go up. But if you're having a lot of nausea, you're like, oh, I'm feeling horrible. Despite the slow weight loss, we wouldn't go up either. Does that make sense?